Good evening, everyone, and welcome to our Ask the Experts, where we have Dr. Kimberly Turner, our First Lady at St. John Baptist Church, and Dr. Donna Neale, who will be leading us in our conversation today about COVID and pregnancy. Come on in the room and let us know that you're here. Say hello.
Good evening, everyone.
Hi, everybody.
As you enter the room, we ask that you like the video and share it as you enter. Let us know you're here by giving us a hello, a wave.
Hello, Sister Ann. Welcome.
All right, quick question. Am I supposed to be able to see who's coming in as well?
Probably won't.
Okay. Well, hello. We're so glad that you joined us tonight.
Good evening, Natalia. Welcome. Thank you for joining us for tonight's candid conversation, Ask the Experts. And we have Dr. Kimberly Turner and Dr. Donna Neale, who will be joining us to talk about COVID and pregnancy. So welcome, everyone. We're so glad you joined us this evening. We're going to give it a few more minutes for people to come on in, and then we are going to start our session.
Great. As you enter, again, just remember it increases our viewership. If you like the video and share it, that would be amazing. We would really appreciate it as we discuss this important topic and try to address some of the vaccine hesitancy, particularly among pregnant women.
Awesome. Hello, everyone. Thank you for joining.
Welcome.
Welcome, Deanna. It's good to see you. Well, on the screen, that is. Welcome. Welcome, Pastor Ricky. All
That's
right.
the first male, isn't it?
Yes. We're so excited tonight. We are coming together to have candid conversations with Dr. Kimberly Turner and Dr. Donna Neale about COVID and pregnancy. So we are looking forward to having a great time this evening and giving some valuable information that you can share with your loved ones, your family members, your neighbors, and your friends. And to get everyone educated about the vaccine so that you can get vaccinated. So we can put an end to this pandemic.
Yes.
Good evening, Reverend Shazetta.
Good evening. Good to see everyone virtually.
All right. Well, we are going to get started. We are not going to belabor this any longer. I am going to turn this over to Dr. Kimberly Turner. And yes, she is St. John's First Lady and also a doctor at OBGYN and has her own practice and works for the hospital. So we are excited to have her, and also Dr. Donna Neale, who is joining her, who is a friend and a colleague. And so, ladies, take it away.
All right. Well, thank you so much, Lisa, for setting this up for us. And thank you to Pastor Turner, who, of course, I call husband, for allowing us to discuss this topic. Of course, everything is new. A lot of people have a lot of questions. Everything that we're going to talk about is the latest evidence on COVID and pregnancy. And of course, the story is evolving, as you probably can imagine. You guys know me, about St. John Baptist Church. So thank you again for joining. This is Dr. Donna Neale, who is my friend and colleague of, I believe it's close to now 15 years at Howard County General. So Dr. Neale started her education at Brown University and went on to do medical school at Georgetown. Am I correct?
Boston.
Boston University. Sorry, I knew that. Did a residency at Georgetown University and did a fellowship in what's called maternal and fetal medicine at Yale University. Everyone from Columbia may know her. She's one of Columbia's own. She went to Oakland Mills High School. She was a track star there. She and I have not only worked together, we've exercised together. We help people stay healthy. That's also one of her areas of focus, is how to stay healthy in pregnancy with weight and exercise. So thank you so much for taking time out of, I think, your vacation to join us here at St. John Baptist Church.
Well, thanks for having me, Kim. Thanks, everybody. I can't see anybody, so everybody who's on the conversation, thanks for joining. I also want to thank the church for putting this together, because it's such an important conversation to have in general, but certainly when we think about what happens during pregnancy, and certainly when we think about, what is the efficacy of the vaccine, on top, and layering that all on top of what we know is vaccine hesitancy, particularly in the Black and Brown community. So thank you for putting the conversation together, and thank you for inviting me to participate in the conversation. I'm really looking forward to sharing what I know, and listening to what you guys have to say about it, and just really coming up with good dialogue.
Yes. And tonight we do have a sponsor. It's the Jack and Jill of America Incorporated. Just very quickly, also want to thank them, President Cynthia Bell and Vice President Dr. Michelle Brooks, for sponsoring this event for us. Just really quickly, Jack and Jill of America Incorporated is an organization of mothers dedicated to raising the next generation of African American leaders while enhancing the lives of all children. They work to accomplish their mission through diverse programs focused on leadership development, cultural exposure, community service, legislative advocacy, and philanthropic giving. The Columbia, Maryland chapter, which now is a 2-time 5-star chapter in the region and in the country, has been serving Howard County for over 50 years. So thank you so much to my friends, my ex-Jack and Jill members. I have graduated out of Jack and Jill, as both of our children are now in college. So thank you again. So let's get started, Donna. Is it okay to call you Donna during this conversation?
Yeah, definitely call me Donna. Yes.
So I'd like you to discuss for our viewership the 3 available vaccines that women can get.
So currently what's available on the market is the Pfizer vaccine and the Moderna vaccine. And I put those 2 together because they're kind of the same technique and technology in terms of how the vaccine works. And then there's also the Johnson & Johnson vaccine, which really is a traditional type of vaccine that we all have had throughout our lives. And either, any of the 3 that you have the opportunity to get, I would say don't miss your shot. For all those Hamilton fans out there, don't miss your shot. And then we certainly can talk more in detail, in our dialogue in terms of which one to get if you have a choice.
All right. Oh, and I just did want to interrupt my questions for Dr. Neale with, if anyone from the audience has questions, please type them in the chat, and Lisa will get those to us as they come or at the end. So we appreciate any interaction and interactive dialogue that we can continue to have with our viewership. So Donna, do you have any advice on which one's the best, especially for women, or especially if you're going to get pregnant or you're already pregnant?
Yeah, so I think, like I said, if you're any Hamilton fan, if you have the opportunity to get a shot. If you have an opportunity to have your shot and have a choice of the shot, I do have a couple comments. So most of the joiners on this talk may have heard about some of the concerns the Johnson & Johnson vaccine has. It's a single shot. So a lot of people thought, oh, good, I got 1 shot, I'm good, I'm out. But one of the complications, it's really, really rare. I'm going to go over the numbers in a second, but one of the complications that was seen with this vaccine is something called cerebral sinus thrombosis, like a clot in one of the blood vessels in our head. It's a very, very, that in itself is a very, very rare thing to happen in medicine. So to see this happening, in a cluster of women who had received the vaccine made people pause a little bit about the vaccine. But I want to put it in context of the number. So of almost 7 million vaccines that were given of Johnson & Johnson, 6 cases. So I did the math, and that's 0.000086. So it's really rare to happen. But it was interesting that it happened in women, and it happened in women of reproductive age, the ages of 18 to 45. So for that reason, if you had an opportunity to get another shot, I would go with one of the other shots. Again, it's a rare complication. So if you've already got the Johnson & Johnson and you're fine, you're going to be fine, because the average timing of this complication following the vaccine was about 15 days. So if you had the shot months ago, you're good. Don't even worry about it. But going forward, if you have a family member or yourself is contemplating getting the shot, which I hope you are, and I would say, and you have the choice of the others, go with the Moderna or the Pfizer. And I can talk a little bit about the difference between those two, which is not much, but Kim knows this, and those who know me, I always think, education is power, knowledge is power. So I'm always advocating for the patients when you're going in, you know what you're asking for. So a couple little nuances about the Moderna versus Pfizer vaccine. So they both have similar efficacy. The efficacy of the Moderna vaccine is probably 90%, and the efficacy of the Pfizer vaccine is up about 95%. So 90 to 95 is not much difference, but again, if you had a choice, Pfizer, Moderna, I would go with the Pfizer. The other thing to know about the two vaccines, again, the technology is just the same. So one is not better than the other in terms of the technology. Interestingly, though, when looking at how many viral particles, or what we call the mRNA particles that are in the vaccine, the Moderna vaccine has about 3 times the number of particles, yet it's not 3 times effective. So I can just share my own personal, research on this. This is not really out there, but I did a lot of research, because just like you guys, I too was, even as a healthcare professional, working all the way through the pandemic, I too was like, should I get the vaccine? Should I not? But at the end, I was like, if I got sick and got really sick and died, shame on me if I didn't get the vaccine. So that's what kind of said, okay, let's get the vaccine. But in doing that, I just want to share a really quick, funny story that, initially I just had to sign up. I work at Johns Hopkins at Howard County with Kim. So we had to sign up. Everybody was initially a lottery, and then you just were happy to get a spot. And so initially I just signed up for the date, as soon as I could get it. And then I started doing my own research. And I was like, oh, maybe I should try to get the Pfizer vaccine. So I happened to, look and see what vaccine I was getting. And it was actually Moderna. But I had done my research, and I was like, I don't want 3 times the number of particles if it's not 3 times more effective. So luckily I was able to kind of find a place where I could get Pfizer. So that's just my own personal story. It's not out there publicized. Again, I had to do a lot of digging to find this information out, and whether it matters, but just personally, I know a lot of the hesitancy about the vaccine stems around, like, what are you putting in your body?
Right.
Women were always concerned, what are we putting in our body? So that's just one little tidbit I would share. If you had the choice between Moderna and Pfizer, I would go Pfizer. But again, I think across the board, if you have one shot, and I would just get that shot.
Well, my little story about getting it, again, she said, we just signed up when we signed up. They let us sign up and come in. So I thought I was going to get Pfizer. We got Moderna. And most of the colleagues that work in my office got Moderna. But in going to the Red Cross, I was able to find out that pre-vaccine, I did not have antibodies, and I had a lot of exposures in the beginning of the pandemic, which we didn't even really know what we were doing. And we needed a mask, and the patients weren't wearing them. So, and then after the vaccine, for the last 3 months, I've given blood twice, which I'll put my little plug in for that too. We had a blood drive at St. John, and I'm sure we're going to do it again, but there's a critical need in this population that's on our live. If they would like to sign up through the Red Cross again, the pregnant women in Howard County need you. And also you get a free COVID antibody test. So you get to know if you've had your shot, whether or not it was effective.
The other thing I wanted to share too, in terms of Moderna, Pfizer, people thinking about it, when we look at the trials where they were done, it's important to know that Moderna, as well as Johnson & Johnson, had a lot of the participants in the trial were exposed to probably some of the variants that we're seeing now. So that's important to know. So again, don't feel bad if you wanted Pfizer, you got Moderna, or you wanted Moderna, you got Johnson & Johnson. In fact, Johnson & Johnson, a lot of the participants in that trial were exposed, were from South Africa. So they saw that South African variant, and it was very, very effective against the variant. So that's something important to keep in mind too. I mean, there's so many layers to this puzzle and this story about COVID. Sure. As Dr. Turner was saying, we've learned so much, but my point is that they all work. So if you don't miss your shot.
Don't miss your shot. So I see in the corner here of my computer that it's going to reboot in 10 minutes. So we are live. If I leave, I will come back as soon as my computer allows. So Dr. Neale may have to take over for me.
Okay, I'll do my best.
At some point. Hopefully I have the last 9 minutes so to keep going. All right, so next, can you comment for women? This is what they're asking me. Is it safe for the mom and baby? Is it effective? How do you know? There hasn't been a lot of studies. Can you comment on that?
Yeah, so these are all great questions. And think about it, even if we're not talking about COVID, as a pregnant woman, that's the one, I mean, if any time in your life you want to do what's best for somebody else, it's when you're pregnant, right? Because really you want to do whatever's going to yield a healthy pregnancy. So these are excellent questions, and patients shouldn't feel afraid to talk to your providers about these things because they're great questions to have. But I like to break them each down. So the first question is it safe? So what we talk to our patients, we're very transparent with the patients.
Yes.
I always share with patients, none of the big trials included pregnant women, not because we thought there was a problem. It's just that the drug companies wanted to get these vaccines out. And anytime you work with special populations, such as pregnant populations, it takes longer. So from a public health perspective, that's really the reason why pregnant women weren't included initially. We, as a field of medicine, OBGYNs, maternal fetal medicine specialists, we fought hard to say, hey, we need to include pregnant women. We walk, as women and as pregnant women, we walk around life just like the non-pregnant person. And there are lots of pregnant women, and we need to be protected. So we fought to get the pregnant women in, and that's just where we're at now in terms of pregnant women are getting the vaccine, and we're following them. The CDC is actually following women. So I always tell patients up front, yes, we know the initial trials did not have pregnant women, but there are a couple things to know. First, there's nothing about this vaccine that we would think would not do well in pregnancy.
Right.
We vaccinate pregnant women all the time for lots and lots of things, lots of things. And it's nothing about the technique of this vaccine that would be bad for a pregnancy, number one. From a biologic plausibility stat, say it's nothing wrong with this vaccine. It's just that the pregnant women weren't included in the trial. However, now that pregnant women are receiving the vaccine, the CDC has actually started a registry. And about 2.5 months ago now, they put out data from the first over 100 women who received the vaccine. And of those 100 women who received the vaccine, zero had any any acute pregnancy issue. So no preterm delivery, miscarriage, preeclampsia, none of that. Zero. 99% of those women, the babies had antibodies. So the babies showed protection. And then the last piece of this, when we think about exposures during pregnancy, it's not only the short term, but we think about what's the long term. Like, if my baby sees the vaccine in utero, is it going to be a problem? We don't have that data just because this is a new vaccine. So I'm always really transparent with patients about those areas. Like, we don't have a lot of data, but what we have looks good in terms of short-term pregnancy outcomes. There should be no problem. Newborns are getting protected because they are showing they have the antibodies. The only piece we don't have is is there any potential long-term effect if you get the vaccine and your fetus, your babies, was exposed to that vaccine? We don't have it. So we're just honest with patients. But one thing I also share with patients, and this information is not to scare anybody who's pregnant on the line, but it's important to understand. And that is, if we compared pregnant me versus non-pregnant me, and I got COVID, the pregnant me is going to do so much worse. That we know hands down. Pregnant women with COVID do worse than their non-pregnant cohort. So if we adjust for how old a woman is, her weight, her race, any comorbidities, like any other medical problems like high blood pressure, diabetes, the pregnant woman who gets the COVID does so much worse than the non-pregnant woman. So for those reasons, we are advocating women who want to get the vaccine, we support it. If you don't want to get the vaccine, we support that too. And then we just continue education regarding the social distancing, wearing your mask, washing hands. I mean, these things are the things that kept us safe before we had a vaccine. So we know these things work. And lastly, I just want to put a little plug in about a story. I don't know if you guys may have seen on the news yesterday. So in Florida, there's a incident going on right now where 6 workers were working in a Florida government office in Florida, and actually 7 workers. One was vaccinated, the other 6 were not. All 6 of the non-vaccinated workers came down with COVID. 2 of them died. Those who died were 40 and 50, and the other 4 were all hospitalized. The only one, again, they all were working in the same area. The only one who did not get sick was the one who was vaccinated. So I think that is, it's 7 people, but it illustrates the efficacy of the vaccine. So I just wanted to share that story.
Right. That's a really powerful reminder that the vaccine is definitely helping us. I want to give a minute just to talk a little bit about the relationship between me, who's an OBGYN in the community, and Dr. Neale, who is a subspecialist. So OBGYNs are specialists, and MFM, or maternal fetal medicine doctors, are subspecialists. So they really help us to stay up with the latest research. They talk to any patient who has any high-risk condition. We're so blessed in Howard County that in our office, they pretty much see all of our patients. Over 90% of our patients get the expertise of a doctor like Dr. Neale. So anyone who's contemplating pregnancy, we work really well as a team, and we would encourage you to seek out one of the members of our team.
Definitely. I'm going to back and tell another little story. I like stories, so I'll tell another little story. And Kim knows this story, but many people on the line probably don't, because I'm old, because we're old. But I did grow up in the
same age, by the way.
in Columbia. And I had a wonderful, childhood in Columbia. I feel like I owed so much to the Columbia, Howard County community for all that I was able to do growing up, all that I was able to do post growing up, and things that I'm still doing. I mean, I just feel like it was such a great community. So when I was, like Dr. Turner said, I was at Yale, I trained there, I stayed on faculty there, and I had the opportunity to come back home. This is home for me. And when I came back to Hopkins, I would come to Howard County Hospital like 1 day a week. And I'm thinking, like, why don't we have maternal fetal medicine at Howard County? We do a lot of deliveries. And so when I had the opportunity to come back and have this role as the director of maternal fetal medicine, for me, it was my opportunity to give back to the community, because again, I have so much love and so much joy and so much gratitude for the Howard County, Columbia community. For me, it's fun. Like when I come to work, I actually enjoy. I mean, Kim knows, Dr. Turner knows this, because I'm talking to her all the time on the phone, and I'm just like, I'm having fun. And I just think it's so important to give back to the community. So again, that's why I'm so grateful and humbled to be a part of this conversation. And so if there are any patients out there contemplating pregnancy, even if there's some mates out there, partners out there whose wives or partners or wives are contemplating pregnancy, they have questions, please, connect with Dr. Turner in her office, connect with me in my office. We see patients, we love to see people preconceptual. So before they're ready to have their baby, to talk about whatever questions they have, whatever concerns they may have, to ultimately have a positive, healthy outcome in their pregnancy. So I want to get a little plug about giving back.
Well, I think mine was a little bit circuitous, because I decided to go into Baltimore and try to heal that land first before your pastor kind of brought me back. So same though, growing up in Howard County, it was a blessing and is a blessing, and raising your children there. I'm raising my children there, or did. They're now almost grown up. And giving back to the community. Every time I drive to work, I have that same feeling. Like, I remember my father teaching me to drive on the same street that I now drive to work.
Yeah, really, it's crazy.
So it is a blessing that these hometown girls are still in the hometown area. All right. So can you talk a little bit about the side effects that women are going to have if they get any of these vaccines? Especially, are they different when you're pregnant?
So first, let's just say that you don't necessarily going to get a side effect. Some vaccines you do, some people get it, some people don't. So it's very variable. I have some theories on it. We can talk about that. But there's some things you can protect yourself. I firmly believe the most well-rested and well-hydrated, you're going to do better. Some of the side effects people will get is they get like a flu-like feeling, like headache, diarrhea, body aches, even fever. And so those symptoms short-term are fine in pregnancy. Just the most important thing is to get the temperature down. So if you have a high fever, you would take Tylenol, and that's safe to use in pregnancy. But again, the more hydrated you are, getting that vaccine and those first 24 hours, you tend to do better.
Right.
So please know, it's not a one-to-one correlation. If you get the vaccine, you're going to get a side effect. You may not. Again, really important, if you get the Johnson & Johnson vaccine note, if all of a sudden you develop a really bad headache, numbness, you're slurring your speech, blurred vision, anything like that, you want to bring that to attention to your doctor immediately. So I don't know if Dr. Turner left, so it might just be me, and hopefully she'll come back and join. I did see one question come up in the chat room. I couldn't see the name. It was Sandra, and she said, do you ever discourage any pregnant women not to obtain the vaccine? And so there are some circumstances, perhaps you don't want to get the vaccine, and that's if you're currently having an illness, any kind of illness, then we would wait on the vaccine. If you've had a reaction to vaccines in the past, there are people who have had reactions to vaccine, people who are allergic to some of the preservatives that the vaccines place, particularly like eggs is one of them. Or if you've had a reaction to the flu vaccine, then you want to probably hold on getting the vaccine, or at least talk to your primary care doctor about that. If there's something acute going on medically where you're not stable medically, then we would not give you the vaccine. So if you're, say, having your blood pressure is too high, we can't control it, because sometimes blood pressure will go up after the vaccine. We get any underlying medical condition controlled before we would give you the vaccine. But again, most women who are pregnant are healthy and should be able to tolerate the vaccine just fine. So I cannot see that. That was the only thing I saw in the chat. I don't know if anybody has any other chat questions. I can talk some more just in terms of COVID and pregnancy. And so one of the things I want to make sure people on the call recognize is that the pandemic's not over. I mean, we've come a long, long way in a year. It's amazing, honestly, to have a vaccine and trying to almost over 70% of adults in Maryland who have at least one shot of the vaccine. We've come a long, long way, but it's not over. And so it's important to know, what are the endpoints of the vaccination program? And so the vaccine, the endpoints were trying to prevent severe illness, where a person would be hospitalized in the intensive care unit and certainly would die, be fatal. So those are the endpoints of the vaccine. You guys have probably even heard stories where people who got the vaccine actually contracted COVID. That is possible. But you also should hear almost the majority of people who've had the vaccine and contracted COVID have a much, much milder disease, and certainly have avoided hospitalization. So that's really what we're trying to avoid with the vaccine. It's similarly like when you get the flu vaccine. You get the flu vaccine, the goal of that, and sometimes you get the flu, but the goal is not to get such a bad flu that you would end up in the hospital. And when I'm making these comments, I am no way, in no shape or form, equating the COVID virus with the flu or a normal cold. I am not doing that. This is a very different illness. It's so new in terms of the immunity we have in our community, and the way it functions is so different. I am not equating the two. I was just trying to make the distinction, or make the comparison, that when we get vaccines, sometimes we get the illness, but it's not as bad. And that's really what we're trying to avoid, is a bad, severe illness, like I said, leading to hospitalization or ICU admission, or even death. So I just wanted to throw that out there, if people were thinking about that. The other big thing to talk about, this, I feel like it's always the elephant in the room, is like this question of, was the vaccine inserting a chip into your body? I think when people heard mRNA, they worried about DNA, and then they worried about your genes, and people were thinking about, all kinds of things went on in people's minds. So I want to spend a little time talking about that. And the first is that mRNA is different than DNA. So the way the vaccines, Moderna and Pfizer, work, mRNA is kind of like the instructions to your cells to make proteins. So what happens is you get the shot in your arm, the mRNA. That mRNA gives instructions to the cells to make a protein against one of the proteins on the COVID virus, something called the spike protein. So your cells just start making this protein. Your immune system says, hey, I've never seen that protein before. So your immune system starts making antibodies against that protein. And then you kind of just store those proteins in a jar, just there. So in comes, say you get exposed to COVID. In comes the COVID virus with the protein. It has the spike protein. And your antibodies say, oops, I've seen this before. And your antibodies come out, attached to that spike protein, and remove the virus out of your system. And it's that spike protein that we think causes people to get so ill. And so it's really important to be able to remove that spike protein. If you notice, I didn't say anything about DNA. I didn't say anything about inserting into the cell. once that protein is made against the spike protein, those instructions go away. They're not inserted into your genome. It doesn't change who you are. There's no chip being inserted or anything like that. It's purely directing your cells to make a protein so that your immune cells can make an antibody against the protein. And then you have those antibodies that float around and, that stay around in your system in case you see the real thing. So I always say it's like if you get it's like a dress rehearsal. Like your body's making the proteins in case you need it. And then if you have the real deal, it's like, oops, I've seen this protein and I can take care of it. So Kim, when you went off, I kind of went by myself.
Thank
and
you.
we were just talking about how mRNA proteins, vaccines work, because I know part of the hesitancy initially was this concern that the vaccines were changing your DNA and inserting a chip into your body. So I just went over how the vaccine works while you were gone.
Okay. All right. Thank you so much.
Yeah, I was like, where'd you go?
I couldn't prevent it. Oh my goodness. Okay. You kind of went over, now that the pandemic is technically starting to be over, are there any additional things that women who are considering pregnancy or are pregnant should do in terms of their self-care during the pandemic?
So one of the things I just shared too is that the pandemic's not over. I shared that we've come a long way. I mean, it's amazing where we've come. And the vaccine, like I said, over 70% of adults in Maryland have received at least one vaccine, one shot. So it's not over.
Even better than that, I think.
Yeah, I think we're up in the top.
Yes.
So it's not over, but I think it's important for people to know it's not over, but we've come a long way. So we're not where we were a year ago. So I'm still recommending people to, maintain their social distancing, wear your mask when you're inside. I think there's a lot of confusion. I know. I mean, unfortunately, a lot about our interventions got very politicized, with the last administration a year ago. And that was unfortunate because I think it was confusing to everybody, it's unfortunate that happened, but I think people are coming out of that fog now. But in the same, things change so quickly, that can be confusing. So it's hard to keep up sometimes. So I think when you question, should you wear a mask, you probably should. There's nothing wrong with it, but definitely inside, I would definitely wear a mask. Definitely wash your hands. Hand washing works for lots of things. I think one of the silver linings for the pandemic, there have been many, and one of them is that it's kind of taught us how to wash our hands. I mean, how many times do you wash your hands for 20 seconds? Rarely, except when we're scrubbing for surgery, you know what I mean? But I think washing your hands goes a long, long way. So I would continue that behavior. I also think know who you're with. I mean, it's okay to ask people, are you vaccinated or not? And one of the things, Kim, we talked about was vaccination. The endpoint of vaccination was not you weren't going to get COVID. The endpoint of vaccination is that you weren't going to get sick with COVID, that you'd be hospitalized in the ICU or even die. So it's possible to get COVID with after being vaccinated. However, the majority of people where that happens, they have a much milder disease. So I think it's important to keep that. Don't get lulled into the sense of total security just because you're around everybody who's vaccinated. And then in terms of self-care, I mean, we've been through a lot, whether you were a healthcare provider, you were home with your kids with, virtual learning, you got furloughed from your job, you were home just with everybody trying to learn, Zoom. You lost a loved one, you lost a friend. I mean, as a society, I feel like we've been through a lot in this year. So one of the things I think we can't be remiss about in terms of taking care of ourselves, in addition to all the COVID, precautions, just check in with yourself. Like, how are you doing? For people who were in healthcare, we were just going forward. We didn't really pause to say, how are we doing? And like I said, and anybody who's been in those other scenarios, it's like, check in. How do you feel? Take a moment. I mean, even if you were furloughed, you really weren't relaxed, right? Because you were worried about when, were you going to get another job, or, were you going to get some stimulus payment, that type of thing. So I think now is a good time for everybody, no matter where what happened to them over the year, to check in, how am I doing mentally? How am I doing emotionally? Have I rested? I mean, many people didn't sleep for a year. They were afraid, what was going to be on, the combination of the pandemic, the election, all the police brutality, the Black Lives Matter. I mean, there was a lot going on that kind of like a triple tap for the Black and brown community, because we had the election going on. We had, all the social injustice that we know have been going on for 400 years that finally people got woke to. We got all the police brutality. And then we're being told if we get COVID, we're going to die. We're going to be the ones. So I want to, just underscore the importance of checking in with yourself and your family members, your friends. Like, how are people doing? Plus, we've been isolated from those that we care about, our families, our friends. So check in. That's a big piece, I think, right now, and to check in, do emotional check-in, seek help. There's a lot of programs out available in the community in Howard County. Talk to people. Share your story. Everybody has a story, and it's often you feel isolated already from a physicality, just being separated. And then you feel isolated if you feel like you're the only one who had a certain situation. But when you share your story, you've learned that there's somebody else who had a similar story, and you may learn something from them, and they may learn something from you. So I don't want to miss that piece of it.
Yeah, I think it's so important, and I think it is something in our community that we don't often talk about, is the mental health. It was really nice to see what was going on in the tennis community with Naomi Osaka and taking time that she needed. And I'm happy to announce that I think both Dr. Neale and I are either on or about to embark on some time for ourselves and our families.
Yes.
After, to get a little bit of a break. The mental health providers, I think, too, really went through a lot and are continuing. So we also thank them for their support. At our community, again, we are really blessed. We're plugged into so many different types of specialists and subspecialists. So any woman in the community that needs any help, you can reach out to either one of us, and we can get you connected. All right, I think just about everything that I wanted to ask, you answered. I did want to just take 1 second or two to ask Dr. Neale to explain what the American College of OBGYN does in this realm, and why we basically guide our clinical decisions, not only with the research, but also what's recommended by the American College of OBGYN as it pertains to pregnant women and vaccination.
So the American College of OBGYN is a kind of conglomerate of members, including Dr. Turner, myself, people all over the country. And so the key, there's many pieces, I think, they have like a quadpartite mission. They are advocates. They go to the Hill. They advocate for women's health. They advocate for research on healthcare disparities and women's health. They put out education materials for physicians as well as for patients, because as we started off the talk, knowledge is power. And it's important for patients to have the knowledge, but it's also important for providers to have that knowledge. Everybody can't be an expert in everything. And so the nice thing about the American College of OBGYN, there are different sections of it. And so if there's an issue in obstetrics, there's a panel of obstetricians who are experts who can they can pull together all the literature, look at all the studies, and kind of come up with their recommendations. And that can be onerous. So, while doctors are taking care of patients, you don't necessarily have all that time. So it's nice to have a panel that can do that. We don't have that time. And that information's been vetted. So when you're sharing, you feel comfortable, you feel confident that when you're sharing information with your patients, you are sharing the latest. And I think the pandemic really showed us the value of an organization like ACOG, because the latest, was old like a minute ago. That's how quickly everything was changing.
I've gotten so many daily emails. If you read one,
oh my God,
read this one.
It was crazy. You know what I mean? So it was good to know that what we're sharing with our patients, it's accurate. And I think that's important for all the patients on the line, because, before COVID, there's been a lot of healthcare hesitancy in the Black and brown community. We look back at the Tuskegee experiment, people don't forget those things. We look back on, pain medicine given to patients when they present to the hospital, children, Black and brown children being treated for ear infections, less likely with antibiotics. So there's a lot of hesitancy. The Henrietta Lack story right at Hopkins, there's a lot of mistrust or distrust in the Black and brown community in healthcare. We recognize that. We would be remiss as Black and brown providers not to see that. So I think it's important for all the patients on the line to understand that you, within a position such as Dr. Turner, myself, and I really would say all the physicians who practice at Howard County, the physicians they're working with the most up-to-date information that we have. We meaning as a field of medicine, not somebody who's just kind of going by the seat of their pants. And I think that's important for patients to know that, so that when you're having conversations with your providers, even if they don't look like you, they don't look like Dr. Turner and myself, you have some sense of confidence that they are sharing the most up-to-date information and not leaving something out because of who you are, of who you look like. So I think ACOG, and in addition to ACOG around this area, the Society of Maternal Fetal Medicine, which is my society, worked hand in hand. AWOM, the Nurses Society, the Public Health Societies, all the CDC, all worked hand in hand to give the best recommendation that we could come up with all the information we had at hand. So I want you guys on the line to know that and definitely in Howard County, that is the community, that's the medical community. Like we've raised the bar. I mean, our feeling in terms of maternal fetal medicine, was that we don't need to have patients drive to Baltimore. Like I always say, you don't have to be under the dome, the Hopkins Dome, to be able to give excellent healthcare. And Howard County is a vibrant community, and we want to make sure the patients in Howard County have access to, the latest and the greatest. Now, if there's something that's going on with the patient that needs to escalate, there are lots of resources at Hopkins because the size of the hospital. And sometimes patients do need to go downtown. But I have to say, I feel like the obstetrical service at Howard County really offers the patients in our community, standard, above standard, state-of-the-art care.
I would totally agree. Under your leadership and that of Dr. Neale, we have come a long way in just the short time that I've been there. I was also really proud of Hopkins as an entity in the last OBGYN grand rounds. So every time a case is now presented, they also talk about the social determinants of health. And they discussed, were there biases? Were there racist things? Was it just social, like poverty, and how that really culminates in a patient's care? So I think that, we are definitely listening, and I hope that patients understand that all the providers are even being retrained to really think and really listen, especially to Black and brown people. Because at some point, everybody has to take part of this conversation too.
The other thing I think I wanted to share too about, I don't know if there were some questions in the chat, but about a month ago, there was a lot of chatter about the vaccine leading to miscarriage, and the vaccine leading to infertility, and the vaccine leading to menstrual irregularities. So I just wanted to touch base about that a little bit. I did pull some data on that, and I wanted to go over that with you guys. So
Great.
A couple of things just to go over. So looking at this data was dated back from February. Yeah, February. As of February 2021, we had about 1,000, almost 2,000 women who had gotten the vaccine, pregnant women. When we looked at those women, 51% got in the first trimester, so that's early pregnancy, 31 in the second trimester, and 19 in the third trimester. And 275 of those women, this was as of February, so we're in June, so these numbers would be higher, but at that point, 275 women had completed their pregnancy, so they're all done their pregnancy. And for miscarriage, typically in any community, the miscarriage rate is about 26%. That's like your background risk. Of those women who had completed their pregnancy, so almost 300 women who'd gotten the COVID vaccine, the miscarriage less than 20 weeks to gestation was only 15%. So it was lower than the background risk. So that tells us, at least from that 300 women, it's not causing an increase in miscarriages. Similarly, looking at women trying to conceive, so had gotten the vaccine and then tried to conceive, this is kind of delayed data, but there was no uptick in women presenting to the reproductive endocrinologist and fertility specialist trying to get pregnant, saying that they weren't able to get pregnant. So I just wanted to share.
The opposite, doesn't it?
Yeah. I just wanted to, we call them the COVID babies. There's a lot of COVID babies.
Exactly.
So I just wanted to share that because that's another hot thing I know that's out in the press, and I just wanted to squash that. And again, we're humble. I hope that you guys on the call know we're very humble. This pandemic has humbled all those who weren't humble before. I think both Dr. Turner and I are very humble physicians. But even if we weren't, this pandemic humbled everybody. Everybody was humble because it was all brand new. But I want to say, you recognize that we are humble by what we share with our patients, by what we know. So we have time to learn more. So as we're sharing information with you, I will certainly pass it on to Dr. Turner so that if there's something new, hot off the press, she can pass that information to this group and others in your community who are contemplating pregnant and to still have not gotten the vaccine and thinking about it.
Right. All right. Well, thank you so much. Lisa, do we have any questions in the chat?
At this time, I don't see any other questions. I do want to encourage the folks on the line that if you know of someone has not been vaccinated and needs to be vaccinated, St. John Baptist Church now has its own vaccination clinic every Saturday from 12 to 4. So let people know, pass the word along to that St. John Baptist Church is the place to get vaccinated. This has been a wonderful information. I think we all got something, whether we're pregnant or not. We all got some information that we can definitely take back and share. I think that you've brought some things back to our minds to think about that the pandemic is not over. There are folks moving around as if it's not, but we do need to still practice wearing our masks, washing our hands, and social distancing. So this was an awesome time. Do any of you ladies have any final thoughts or anything that you want to share before we have prayer and release everyone?
I'm glad that you reminded the community about our vaccine clinic.
Yes.
Our numbers are slowly going up, and we know we're trying to reach these last, I want to say 19% of Howard Countyans, is that a word? Howard County people that have not gotten the vaccine, and it's free.
There's one more piece I just want to share too. It talks up and that reflects this question of, do you need a booster? So initially when the vaccine came out, there was a question we didn't know, like how long would the immunity last? But I want to share the most recent data that I saw was that what happened, it's a huge study across the country. It's over 30,000 people, people who got the vaccine, and they've been following them, and they've been getting their antibody testing. And they find still 9 months post-vaccine, patients still have antibodies. So that suggests the vaccine is still working. So I just wanted to put that out there because that was swirling around like, I'm not going to get the vaccine now anyway, because I'm going to need a booster. So I'll just wait. Well, right now, we don't even know when that booster will be necessary. Just like a flu shot, it probably will be at some point. But initially, we thought it might be 3 months, maybe 6 months. And now it looks like it might be as long as 9 months, maybe even longer. So I just wanted to put that out there.
Right.
Awesome.
And one other thing that I think that we didn't quite explain that is really important that you're reading a lot about in the news, especially about Black and brown women in pregnancy and bad outcomes. So one of the most important times to address that is before you're considering being pregnant. So Dr. Neale did talk about the preconceptual consultation. That can happen with me. That can happen with her. That's where we go over the things in your pregnancy that might lead to high-risk conditions. Not everything's in our control, but some of those risk factors can go down and make everything safer. And that's a really good time for us to just listen to your concerns as well, even before there's a pregnancy where everything is heightened with the concern and the anxiety. Please reach out for that as well.
Because I feel, Kim, Dr. Turner's heard me say this multiple times, but one of the theories I have is that, pregnancy is a stress test for life. So how you do in pregnancy can dictate how you do the rest of your life in terms of healthcare. And so we have some discrete examples of that. One simple thing is like gestational diabetes. We know 40 to 50% of women who have gestational diabetes, which is diabetes in pregnancy, will go on to develop diabetes at some point in their life. We also know women who have high blood pressure, like something called preeclampsia in pregnancy. Ultimately, many of those women will go on to have cardiovascular issues like high blood pressure, even strokes and that type of thing later in life. But on the positive side, we also know that the one time in life where a lot of behavior modification can happen is during pregnancy. So women stop smoking during pregnancy much easier than any other time in their lives. All of us take vitamins that, that are this big that we thought we would never be able to swallow, but we do it during pregnancy. So not only can the pregnancy be a time where you worry about risk factors, but it also it's a time to show you what you can do as a woman. Like what are you capable of? What's your potential? And so I think that's something that you can carry through the rest of your life too. So when I talk about it being the stress test, it doesn't have to be a bad stress test. It can be a good stress test. And it often pregnancy can give women the confidence again to do other things in their lives. And so that's kind of the model we have in terms of when we're taking care of our patients.
Sure.
We have a question from Ann Cunningham, and she may have missed the answer, but she said, can a person get COVID-19 for a second time?
Yes. The answer is yes.
Yes, unfortunately.
Yes.
I personally haven't seen somebody getting COVID in our office that has been vaccinated. And again, what we already have discussed is that those patients would typically have a much milder disease, which is very important in pregnancy when you're already at increased risk.
And I would agree with Dr. Turner. I haven't seen anybody in our office or even in my department down at Hopkins who vaccinated and got the disease, but we've all heard of cases. And it may be related to kind of the timing of the vaccine in the sense that, you have a 2-shot, and it's important to understand the biology of those 2 shots. You do have some protection after the first shot, but when people are talking about this 94 to 90% of efficacy, it's after the second shot. And depending on who you read, it could be 1 week after the second shot, it could be 2 weeks after the second shot. And so we know some of the cases I heard of people who got vaccinated and got COVID were people who were getting the COVID in that window between the first and second shot, or a couple weeks after the first shot. And so the question was, did they really have COVID before? Because there is that 2-week period, got the shot and then had symptoms and then got tested. So that's another part of the piece of the puzzle that can be a little not as clear.
Wow.
Okay,
Awesome.
Well, thank you again, Dr. Neale, for your time. We welcome you at St. John Baptist Church when it reopens, maybe in the fall, I'm being told. And I don't have any inside information on that. Lisa probably knows more than I do. But I'd like to just close. Thank you again to Jack and Jill of America for sponsoring. It's a women's organization, so health of women is one of the really important tenets of their purview as well.
And I also would say thank you to Jack and Jill. I was a member of Jack and Jill growing up. So when I think about giving back, not the Columbia chapter, but in another chapter, but certainly, as a great organization, again, to give women those leadership skills, kind of that voice, meeting other, Black and brown women, which I think is really important for us to be together. So I would echo Dr. Turner's thank you to Jack and Jill for sponsoring this event. It's awesome.
Yes. All right. Well, I will close so that we can be respectful of everyone's time. I'm in California right now, so it's a little different time. So there it's almost 8:00, right? So just to close, I'm going to read a little bit of the Proverbs 31, which is many women's favorite verse about women. And the easy version says, how difficult is it to find a woman that does all things well? She is worth much more than valuable stones. Her husband knows that she will help him. He will never be poor. As long as she lives, she does only good things for him. She is always busy. She makes cloth and she enjoys her work. And I'm going to skip to 15. She gets up while it is still night to prepare food for her family. She tells her other women what they should do. She is strong and she works well. So on that, just to end in prayer, Father God, we just thank you for blessing this 1 hour, and we thank you for St. John Baptist Church being the voice of so many in our community. We thank you for all of the work that is continuing to go on during this pandemic with healthcare workers, mental health workers, and administration and patients. We thank you that this pandemic is finally starting to turn the corner, and while it's not over, God, we have learned so much. We've learned to stay still and listen to your voice. We've learned to continue to seek your voice every day, and we've learned to basic hygiene again. So we just thank you again for all of the mothers and fathers and
soon-to-be mothers and fathers that joined us tonight. We just really appreciate their time. We know that you will bless them for helping and to be a part of this activity. And we ask all of these things in your precious name.
Amen. Amen. Well, that wraps us up. Is that Reverend Turner?
Of course.
Well, that wraps us up for tonight. We want to thank you again for joining us for our candid conversations of COVID-19 and pregnancy. Join us again next Tuesday, where we will have more conversations around COVID. Thank you so much for joining us. Good night, everyone.
Bye.
Good night, everybody. Thank you for having me.